Are you tired of rushing to the bathroom and feeling like anytime that urgency hits, you can't control it, or else you're going to have an accident? Or worse, waking up at night multiple times to go to the bathroom where you can't really get a good night's sleep? If these symptoms sound familiar, then you may be suffering from overactive bladder. And in today's video, we will be discussing the treatment options for overactive bladder. Hi everyone, I'm Dr. Nabila Noor, board certified and fellowship trained urogynecologist and a pelvic reconstructive surgeon. If you're new to the channel, here we discuss everything pelvic health. So if you like what you see, don't forget to subscribe it and share it with a friend. And at the end of today's video, I do have a freebie for you, so keep watching. Overactive bladder is more common than you think. 12 to 16% of adults worldwide are suffering with overactive bladder, which means there are millions of people with this condition. But what is overactive bladder? It's a syndrome that combines various different symptoms. Symptoms such as urinary urgency, urinary frequency, leakage associated with that known as urgency-related urinary incontinence, as well as nocturia, which is the nighttime urination. I have a separate video that I'm going to link down below where I talk about in details about what are the symptoms of overactive bladder, what causes it, a little bit of pathophysiology about the bladder, so make sure you check it out. But in today's video, I want to focus on the various treatment options. The good thing about overactive bladder is we have some amazing treatment options, both conservative as well as some interventions, and it has significantly changed how we treat women suffering with overactive bladder. So when I have a patient in my office who's coming to me because they think they have symptoms of overactive bladder, there are a few things that I do at the beginning to make sure that their symptoms are not caused by any other diagnoses. For example, a UTI or a urinary tract infection can also have some of the same symptoms of urinary urgency, frequency, not being able to make it to the bathroom. So it's very important to rule out a urinary tract infection. Similarly, if a patient have had previous surgeries in their bladder or any kind of pelvic surgery, especially with the usage of mesh, it's very, very important to take a look inside the bladder, make sure that there's no abnormalities or the mesh hasn't migrated to the bladder where it can irritate the bladder and cause similar symptoms. And of course, you want to rule out any signs of bladder cancer. So if patients are complaining of urinary urgency frequency, but they're also saying that they notice blood in the urine, then that's a red flag. And you want to rule out things like a bladder stone or worse, bladder cancer, especially if they have a history of smoking. Once you have ruled out all the other pathologies and you have made a diagnosis of overactive bladder, I talk to patients about the various different treatment options. The first line treatment options for overactive bladder is basically lifestyle changes. Now, what do I mean by that? Number one, there are things called bladder irritants if we consume, which if we drink or eat can irritate the walls of the bladder and cause the overactive bladder symptoms to get worse. Things like caffeine, tea, soda, or any kind of carbonated beverages. Foods for some patients such as spicy food, citrusy food, artificial sweetener, alcohol, chocolate, believe it or not. So if you're somebody who notices a correlation with some of these foods, cutting them down can be really beneficial. Trust me, we love our coffee and tea. I am just as guilty. But if you're somebody who's doing 4 to 5 cups of coffee or soda in a day and you're really suffering with the overactive bladder symptoms, cutting them down to maybe 1 or 2 cups, or in case of coffee, switching to a decaf option may help your symptoms. Number 2, fluid titration. Now, in today's day and age where everybody's moving around with a Stanley cup, it's good to keep yourself hydrated, but overdoing it can sometimes exacerbate your overactive bladder symptoms. Now, what's normal fluid that we should be having? So usually the recommendations are about 64 ounces. So if your cup or your glass is about 8 ounces, that's about 8 glasses of water every day. Now, of course, if you have any other medical conditions because of which you need to have more or less water, then that is something to discuss with your physician. But in general, 8 glasses of water is good enough. If you are drinking more than that and you're going to the bathroom, then that's because you have functioning kidney. Doesn't necessarily mean it's a pathology, so maybe titrating the fluid a little bit and decreasing the volume may be a simple way to improve your symptoms. Pelvic floor exercises such as Kegel exercises can help patients learn how to strengthen their pelvic floor muscles. So when they have the urgency to go, they can start doing some Kegel exercises to help suppress that urge sensation. Now, similarly, we talk to patients about something called bladder training. What that means is you're retraining the bladder to not give in to that urge. So a lot of the times when patients have that urgency sensation, it's just a sensation. It's not that they have to go to the bathroom because their bladder is full, but it's because their bladder muscles are spasming abnormally, giving them the sensation to go. So learning to control that urge, whether it be with Kegel exercises, distracting yourself to control that urge sensation and not give in to that signal, can help patients learn how to prolong that interval period between two voids. So if you're not sure whether you're doing your pelvic floor exercises correctly or doing your bladder training correctly, that can be a good time to talk to a pelvic floor physical therapist who are specialized therapists taking care of patients just like yourself who's suffering from these conditions, and they can help you, guide you, make sure you're learning these techniques the correct way. After lifestyle modifications, we talk about medications. Now, there are different classes of medications and they each have their side effects. Two of the classes of medications that we use, number one is the anticholinergic family, and number two is the beta-3 agonist. Anticholinergic medications are your oxybutynin, trospium, vesicare, ditropan. There are a whole host of them. They each have their own side effects, but in general, as a class, anticholinergic medication can cause constipation, dry eyes, dry mouth, and there has been some new studies that shows for patients who are in the 70s and older, long-term usage of these anticholinergics can cause dementia. So we're actually steering away from prescribing patients anticholinergics routinely like we used to before. One of the anticholinergics that's probably the safest to use and which has been shown to have the least dementia side effects is trospium. So if I have to prescribe a medication to a patient from the anticholinergic family, that's usually my medication of choice. Because of some of the side effect profiles, I actually prefer to start patients on the beta-3 agonist. This consists of two specific medications. Number one is mirabegron or Myrbetriq, and number two is vibegron and Gemtesa, which is a newer drug. These work differently than the anticholinergics, and so the side effect profiles are different, and sometimes it's better tolerated. The problem that comes up with medications sometimes is really a matter of what your insurance covers. So this is a discussion to have with your physician so you can come up with a plan that works best for you. If medications are not a good option, then we talk about third-line options. So third-line options are more invasive procedures that we offer. There are three main ones that we talk about all the time. Number one is bladder Botox. Number two is sacral neuromodulation. And number three is something called peripheral tibial nerve stimulation. So bladder Botox is basically where we inject Botox into the walls of the bladder. Just like Botox in the face, how it gets rid of your wrinkles because it relaxes your facial muscles. Similarly, when we inject Botox into the bladder, it can relax those bladder detrusor muscles and take away that spasm. It can relax the bladder muscles so they're not spasming all the time and take away the sensation that you have to go. Now, bladder Botox does wear off. It's not permanent. For most of my patients, it can last anywhere from about 3 to 6 months. So you will need repeat injection, which means you will need repeat procedures. Second intervention is something called a sacral neuromodulation. The easiest way to explain it is think of it as a pacemaker for the bladder. The reason women have overactive bladder symptoms is because the signaling between the bladder and the brain are not working the right way. So with this device, which is an implant that we put into the body, the communication between the bladder and the brain is fine-tuned, which helps let go of some of the extra signal that the bladder gets that causes them to spasm unnecessarily. So the next one is called peripheral tibial nerve stimulation. So this is almost like getting an acupuncture needle that's usually inserted into the tibial nerve near your ankle. So it is an office-based procedure. The sessions usually last about 30 minutes. We usually do weekly sessions for about 12 weeks where patients come in, we adjust the needle and they just sit for the next 30 minutes. The tibial nerve goes from your leg and goes all the way up to your sacrum and connects with the nerves that's controlling your bladder. So it can help stimulate those bladder nerves as well. Most of these invasive therapies are pretty comparable, but which one is good for you is an individualized discussion to have with your physician, preferably a specialist such as a urogynecologist or a female urologist. They all have their nuances, they all have their risks and benefit profiles, so it's a very individualized discussion taking into consideration your symptoms, your lifestyle, and what's best for your situation. Hope you found this video helpful. As you can see, there are lots of amazing treatment options. You don't have to suffer with symptoms of overactive bladder, and it's not one treatment for everybody. We can individualize the treatment based on your lifestyle, your situation, and your individual condition. As promised, I do have a freebie today, my free Overactive Bladder Health Guide. Click the link below to get it. It's completely free on this, and I hope you find it helpful. To get more up-to-date pelvic health tips, subscribe to my news channel, and I hope to see you soon. Bye!